So right now, we're going to bring these questions to Dr. Anthony Fauci, who is joining us exclusively this morning, right before you head off to get that vaccine yourself. Dr. Fauci, thank you so much for being here with us today. I want to start with that new variant that's there in the UK that is right now causing, understandably, so much concern for so many folks. New York's Governor Andrew Cuomo says he believes that the variant might already be here. Do you believe that that's possible?
That's certainly possible. I mean, when you have this amount of spread within a place like the UK, that you really need to assume that it's here already. It may not, and certainly is not the dominant strain, but I would not be surprised at all if it is already here. So I agree with Governor Cuomo on that.
So if it's possible that it's already here, you've said the prudent thing to do right now is to be careful about this, but to not overreact to it, but that a travel ban isn't necessary at this point. But with so much unknown about this variant, why is a temporary travel ban not the prudent thing to do right now?
Well, you know, travel bans are really rather draconian things to do. There is certain consideration, as you heard from Governor Cuomo for New York, but there's certain consideration throughout about the possibility and maybe the likelihood of requiring the testing of individuals before they board a plane to the United States. That is under active discussion. The governor of New York is already going to do that, or is already doing that. That's a big difference than just completely shutting off and banning travel completely, which is really a rather dramatic step. So that's not really in the cards right now, but I wouldn't be surprised if the requirement of testing is something that is being actively considered right now. Could
you see a travel ban needing to be in place because of this new variant?
Well, I think one of the important things that we need to do, Cecilia, is to actually do surveillance here and find out. It might already be here. I doubt if it's the prevalent strain here, but as the governor said, it is entirely conceivable that it's already here.
I want to talk to you, Dr. Fauci, about a vaccine, and I'm hoping you can clarify the timeline on when most Americans might actually be able to get this vaccine and have access to it. Admiral Gerard, the administration's testing czar, said recently that he expected that all Americans who want a vaccine could get one by June. But President-elect Joe Biden's pick for Surgeon General sort of said that that seemed to be optimistic. He's looking at potentially mid-summer or even as late as early fall. When do you see this happening? When can most Americans get this?
You know, you're going to get different versions of that, as you said, from different people. And I think the reason is the uncertainty about the efficiency of how you get it implemented. In other words, when you say we've now reached the point where it's kind of open season, anybody can get the vaccine, not just the people who are in the priority areas that we're doing right now. You have various priorities over the next couple of months. We likely will be able to start vaccinating people who are in the broader category somewhere around the end of March, the beginning of April. How long it takes to get everyone who needs to be vaccinated is really varies. It depends on the efficiency of the process. So what I have been saying, I think it's correct, but it could be a variability for a month or two. I think we'll start in earnest vaccinating the general population somewhere at the end of March, the beginning of April. It may take 2, 3, 4 months or more before you get everyone vaccinated that wants to be vaccinated. So I think that's the difference in the variability that you're hearing among people. We're really all saying the same thing. We're going to start at a certain time. It may take 2, 3, 4 months before everyone gets vaccinated who needs to be vaccinated. So I would think that by the time we get into the summer, I hope we're almost at the point where you can say everybody who wants to get vaccinated will get vaccinated.
Well, that is good news. And I know that you've signed on to serve as President-elect Joe Biden's chief medical advisor on COVID-19. And we have heard him say that he's going to ask people to wear a mask for the first 100 days of his presidency. Could you share any advice that you've given the president-elect as to what you would like to see him do in those early days?
You know, I don't want to get into the details of it because I want it to be announced when he makes those types of announcements. But one of the things I certainly agree with is trying to really get people uniformly to wear masks. One of the problems that we've had in this country is the disparity of people from one part of the country, another part of the country, doing things differently. We've got to pull together because we're all in this together. If you look at the map of the United States of the increase in cases, it's really quite troublesome. So we've got to just buckle down and everybody adhere to the public health measures, which include the wearing of masks.
Can't say that enough. Now, Dr. Fauci, I know that you were about to head off and get your vaccine, and I want to ask you, after all of these months and everything that we have been through as a country, as a society in general, what's this moment going to be like for you this morning?
Well, I mean, it's an important moment. We have worked, as you probably know, very hard. The vaccine that I'll be getting, there are two out there. They're the Pfizer and the Moderna. I'll be getting the Moderna vaccine. We just got a shipment in yesterday. I feel very good about it because in a large part that vaccine was developed by my group at the NIH. So, you know, it's sort of a double positive. One, in general, I'm doing it because I want to symbolize to people the importance that everyone gets vaccinated who can get vaccinated. But also it's a good feeling of accomplishment because this originated in laboratories in my institute.
You and your team should be certainly very proud. Dr. Fauci, very quickly before we let you go this morning, a final message, a final plea before Christmas to anyone who is listening right now.
Yeah. You know, please do what I suggested for Thanksgiving. We don't want to cancel Christmas, but you have to tone down plans, try to minimize travel, and try to avoid large congregations of people indoors. You know, the dinners that have 20, 25 people. You know, we know how difficult it is in a wonderful season like Christmas to tone down these kinds of things. But we really do need to hang in there. As you know, and as you reported correctly, the situation now of the amount of infection in the community is really rather high. We're in a precarious situation. There is light at the end of the tunnel. Sooner or later, hopefully sooner, within the next several months, vaccines are going to make a serious, important, positive impact. But until then, we really need to adhere to good, prudent public health practices.
Dr. Fauci, thank you so much. As you said, there is light at the end of the tunnel. We appreciate your time this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.